Hello everyone, I'm going to talk about the importance of sex and gender in medical research. We all go to doctors, trusting that the tests and medication we receive are based on evidence meant to help us. However, the reality is that that hasn't always been the case for everyone. What if I told you that the medical science over the past century has been based on only half the population? In the ER, there's a lot of runny nose and stubbed toys. But no matter who was ordered to ER, we order the same test and prescribe the same medication for everyone, regardless of sex or gender. We are never told there are any differences. A recent study revealed that 80% of drugs withdrawn from the market are due to side effects on women. Why are these side effects discovered only after the drugs are released? It turns out that lab cells, animals used in studies, and clinical trial participants are mostly male. This male model has been our framework for medical research. Let's look at an example. Take the sleep aid Ambien. It was prescribed mostly to women because women suffer more sleep disorder than men. But only recently did FDA recommend having the dose for women because they metabolize drugs slower than men, leading to risks like drowsiness and car accident. How many other things need to be analyzed by gender? World War II brought out guidelines to protect people from becoming victims of medical research without informed consent. This part was to protect women of childbearing age from entering into any medical research studies. Scientists thought this was a blessing in disguise because men's bodies are homogeneous and easier to study. As a result, medical research was performed on men, and the results were later applied to women. This led to the concept of bikini medicine, where women's health was synonymous with reproduction. However, an overwhelming amount of evidence has shown us how different men and women are in every way. For example, heart disease is the #1 killer for both men and women. But more women die within the first year of having a heart attack. Men experience crushing chest pain, while women had less specific symptoms like fatigue or shortness of breath. Tested medication like aspirin, designed and tested on men, may not be as effective or even harmful to women. The Institute of Medicine has said, every cell has a sex. Sex is DNA. Every cell in our bodies is influenced by our sex chromosome. This can affect drug dosing, disease susceptibility, and severity. Change is hard but necessary. Awareness is the first step. This isn't just about women's health. It's about personalizing healthcare for everyone. Ask your doctors if your treatments are specific to your sex and gender. Conversation has begun, and together we can improve healthcare for everyone. Thank you for listening.